coming out this morning as well. I know it's not the nicest conditions. So yeah, it's been a super series so far for me anyway. It's been really interesting. So the last one is looking at exercise during pregnancy and postpartum, and this is the one that I've probably been looking forward to the most, because there's just so much new information out there, which is really challenging, I think, challenging the status quo, I think, for women who are pregnant or who are in that kind of postnatal, postpartum period, what we can do, what it's safe for us to do, and kind of, questioning maybe some of the guidance and the recommendations that are currently out there. Are they still relevant? Where did they come from originally? And you'd be surprised, actually, a lot of it is maybe not based on scientific evidence. So we'll kind of have a look through that. Just to kind of, first of all, to get a feel of my audience. So I know you've got children, grandchildren, more on the way. What about yourselves, girls?
It's more just an education thing.
Perfect. Okay, and that's great, because it's kind of future proofing, isn't it? I'm planning ahead. So I suppose just to kind of give a little bit of my own background, I'm a lecturer in DKT in health and physical activity. I have 3 children. And I suppose when I kind of was pregnant on my first baby, it was all so smooth. Everything went brilliantly. I was able to be active the whole way through. I didn't like running. I did try. Didn't like it. Just felt, oh, this is odd, weird, not comfortable. So that was fine. Stuck to kind of walking. I had a 35 kg red setter at the time, so he gave me a good workout every time we went for a walk. So it was great. And as I said, everything went so smooth, went brilliantly. I had my baby in the midwifery-led unit in the Lourdes. She was born in no time. So it was like your textbook pregnancy and delivery. And then a couple of years later, I was pregnant again. And at 20 weeks, my waters broke one morning at home. And I was like, what the hell is going on here? Brought myself into the hospital, was kept admitted and put on bed rest. And I delivered my baby then at 22 and a half weeks, and he died shortly after birth. And that was, from having the most perfect pregnancy, I breezed through it, and I thought, sure, this is a toddle, this is great, everything. Now, I can't say I enjoyed being pregnant. I found it difficult. But, some people, I think, love that kind of state. I didn't love it. It was a means to an end, absolutely. But I had no issues. So it was a massive, upset then and kind of turnaround. It was so unexpected. And then I went on to have 2 more children, thankfully healthy. But those pregnancies were terrifying. I was just walking on eggshells the whole way through those pregnancies. I was afraid to do anything, literally afraid to bend over and tie my shoelaces. I was afraid to sneeze. I was just terrified that any little thing that I would do would rupture my membranes and we'd be back to kind of square one again. So it was a really, really difficult, really challenging period. And I didn't have any guidance, any, kind of guidelines around the benefits of, being active, that I should be active, that there was no risk to me being active. I was told, take it easy. And I think everybody's nearly told that during pregnancy, take it easy. And that seems to be, kind of like the go-to kind of advice, isn't it, And we, it was only kind of in recent years, I suppose, and when I kind of moved into the women's health side of things, and currently I'm doing a doctorate now, which is looking at pregnancy, sport during pregnancy and returning to sport postpartum, that you kind of now, you start to look at the scientific evidence and you think, well, actually, bed rest doesn't have any benefits really, and almost always results in a preterm delivery. And that there's a lot of the maybe guidance around taking it easy is more to do with fear as to do with kind of evidence. So it's really interesting, I suppose, and we'll look at kind of some of the evidence and that now. But I suppose with my last 2 children, they were an induction and a C-section. So my first pregnancy, where I was most active, was definitely my easiest pregnancy and my easiest delivery and my easiest recovery. You know, and I know maybe having younger children at home kind of makes recovery from childbirth and that a little bit harder as well. But I do, when I look back and I reflect on my pregnancies and those journeys, I do kind of think, you know, isn't that interesting? Like, and it's more maybe the lived experience, but it does mirror, I think, what a lot of the scientific evidence is telling us as well. Right, so with regards to what we know about exercise and pregnancy, we know an awful lot more now. There's an amazing research group in Canada led by Dr. Margie Davenport, and I would say for anybody who's interested in following anything, you know, kind of social media-wise, she'd be Dr. Margie, M-A-R-G-I-E, Davenport. She is fantastic in terms of sharing her research on Instagram. She is currently part of the FIFA Pro group who are working at looking at kind of all things women's health and developing guidelines around kind of postpartum return, what's possible during pregnancy, and she's worked with lots of different kind of Olympic committees, sporting organisations across the world. Her research is amazing. So she is, as I was saying, kind of really challenging everything that we thought we knew about exercise during pregnancy and postpartum. And she's putting out an enormous amount of research now, which is kind of giving us a lot more information so that we can make informed decisions then during these time periods. So prior to, I would say, the past few years and the real kind of up speed in the work that she's putting out there, the importance of physical activity during pregnancy wasn't really widely known. Like as I said, I had 4 pregnancies. I wasn't given any advice with regards to being physically active during any of those pregnancies. Never a GP or a midwife said to me, you know, it's important that you're physically active, or it's important that you keep exercising, or that just wasn't considered. It wasn't something that was recommended to me. And I think that seems to be the kind of the norm here in Ireland. You know, you might kind of get a little bit of the basic guidance. If you look at the HSE website, it will tell you it's important to keep active, and you know, but it's very minimal, it's very basic. And what does that mean for us then during pregnancy? But what we do know is that there are better maternal and fetal health outcomes if we're active during pregnancy. So that means that as a mother, you're going to be healthier and you're going to have better long-term outcomes. And we'll look at what that means and kind of what some of the research shows us. But also your baby's going to be healthier too if you're active and you keep exercising regularly. But yet, despite what we know, less than 15% of pregnant people are meeting the physical activity recommendations. And the recommendations are not huge. It's just about 30 minutes. It's like the normal kind of population guidelines. So it's 30 minutes of moderate to intense physical activity per day. So a 30-minute brisk walk, or a gym class, or you know, a yoga Pilates class, or something like that. But essentially, kind of what we see throughout all of the guidance that's given to pregnant mothers is that the risk of not being active is not emphasised. So it's not just a case of, oh, it's good for your health or it's good for your baby to keep active. It's what happens if I'm not active, okay? And a lot of us take, I think, the opportunity or see pregnancy as an opportunity to maybe cut back on kind of what they've been doing, because you know, I suppose women have a complicated relationship, I guess, with their bodies. A lot of people kind of see exercise as that means of keeping in shape, for exercise maybe for aesthetic reasons as much as health reasons. And then during pregnancy, you know that that's going to change anyway. So sometimes we see people take their foot off the gas a little and think, oh, well, you know, I don't have to be as active now as I was. And, you know, maybe also the same kind of relationship with food as well, and think, you know, that it's a period where, well, look, I'm putting on weight anyway, so let's have the extra mince pie or whatever it is. And that's, you know, I'm all for being kind to yourself. Pregnancy is really challenging. But I think we do need to be aware that actually there are a lot of risks to you and your baby of not being active and not exercising regularly during pregnancy, which is sometimes, I don't think, something that we think about. So this is, again, kind of from that researcher, Margie Davenport, that there are some kind of lovely infographics that she's put out there. Sorry, I know it's probably hard for you to read on the the wall there. But essentially, it just says, so Canada have kind of been, that's where Margie's from, so Canada have really been kind of the leaders now in terms of challenging all of those existing recommendations for exercise during pregnancy. And they released new guidelines for exercise during pregnancy and exercise in the postpartum period. And it essentially says, or they kind of state then that all women without medical restrictions should be physically active throughout pregnancy. Studies show that being physically active throughout your pregnancy can reduce your risk of pregnancy-related illnesses such as depression by 25%, and then also gestational, things like gestational diabetes, which is quite common, particularly in Ireland. That the risk of that and preeclampsia can be reduced by 40%. So preeclampsia, we know, is a really serious health complication during pregnancy. So, 40% reduction of your risk of that is absolutely huge. And then this infographic is just a nice kind of visual representation of the guidelines. So you're aiming for 150 minutes of moderate intensity every week. That's like, everything. So it's using the stairs at home, doing some physical housework, doing a home workout, some leisure activities like walk, a swim, an exercise class or something, and then out and about as well, like cycling, out with your other children, things like that. Muscle strengthening exercises twice a week, so no reason why we shouldn't still be doing our resistance training. Every activity counts in bouts of at least 10 minutes, so it doesn't have to be setting aside 30 minutes in one chunk. It could be 3 bouts of 10 minutes throughout the day, 10 minutes yoga when you get up in the morning, a 10-minute walk maybe to work or dropping the kids off to school, whatever it might be. The important thing, I suppose, there is there's no evidence of harm. We've no evidence to suggest that being physically active during pregnancy is harmful to either the mother or the baby. And that's, I think, the kind of really important message here. So as we've seen on the infographic, just to kind of explore that a little bit more, if you're regularly active during pregnancy, you've got a decreased risk of preeclampsia, a life-threatening complication of pregnancy, a decreased risk of gestational diabetes. So that's where people just have diabetes throughout the course of their pregnancy. It typically goes away when the baby has been delivered. However, if you have gestational diabetes, you have a higher risk of developing type 2 diabetes later in life. So that's something I think that we should be really mindful of as well. Hypertension, which again can be a precursor to preeclampsia. Excessive weight gain, so it can help to kind of control the amount of weight that's gained and obviously make weight loss and return into kind of your pre-pregnancy body that little bit easier afterwards. It reduces the risk of delivery complications, so you're less likely to require a cesarean section, less likely to require an instrumental delivery, so things like forceps or vacuum, for example, which can be really, kind of not ideal because they're more damaging to our pelvic floor. And then you're less likely to experience urinary incontinence, which is something that a lot of women will experience during pregnancy or the postpartum period. And then also we'll talk about a little bit more as well is the risk of postpartum depression. And that's one of the most common complications of pregnancy. So if you're active during pregnancy and in the postpartum period, you're less likely to experience postpartum depression or anxiety. We also see a lower incidence of lumbopelvic pain. So that's kind of, again, a typical complication would be pain of the lower back, pain of the pelvic area. And then it's like that kind of catch-22. And sometimes you think, oh, my back is sore, I'm not going to exercise. But then because you don't exercise, the back pain gets worse. So sometimes, kind of maybe adapting the exercises, regressing the exercises, doing something that's more comfortable, but to keep mobility up and keep moving, and that can help to reduce the prevalence of lumbopelvic pain or the severity of it. And then there's fewer newborn complications as well, so it's much more likely that your baby is going to be born healthy. And this is kind of, it's just from a really recent research paper, as you can see, 2023, and it kind of says a lot of the same thing maybe that I mentioned. So decreased muscular joint discomfort, improved cardiovascular health, improved weight management during pregnancy, improved mood, less complicated labour, also a shorter phase of active labour, which I think is really motivational. It certainly would have drove me on to be active. So yeah, less likely to spend excessive length of time in active labour if you've been regularly physically active. And we need to think about childbirth, like, you know, that's a huge event to prepare for. Like, that's like going and doing, you know, a high rocks competition or a CrossFit competition or, you know, a marathon. Like, it is a really challenging physical and physiological event that you are going to put your body through. So if I were to say to you, right, we're all going to go and do like the high rocks competition in Dublin next year, would you go into that without any training? You know, you certainly wouldn't. So, like, you know, you're going to go into potentially, you know, we could be talking a 12-hour plus labour. Would you go into that without doing any training? Like, you do not want to be going into that in the worst physical condition that you've been in. Like, when you think about it logically, we train so hard, and then we get pregnant and we say, oh, this is great now, don't have to train, and, you know, can eat what I want, or I can just take it easy, as everyone keeps telling me to do. And then at the end of that period, you've got this massive competition that you're prepared for, but you're not prepared at all. You've lost all of your fitness. Maybe you've lost all of your confidence and your self-belief because your body has changed so much. You have mood alterations. Remember, there's a lot of hormonal changes happening during pregnancy as well. So I think when we sit back and actually look at it, like, you know, I want to be prepared. If I was to do this again, which I definitely won't be, but if I were to do it again, I would really want to be physically prepared, like I was with my first pregnancy. You know, knowing that I am going into this battle now at my kind of peak physical conditioning, and I'm ready for what's ahead of me. And then on the fetal side of things, like, look at all those benefits. So you've got enhanced stress tolerance of your baby. So if you're experiencing extended labour, your baby's not going to get stressed out. Your baby is okay with this because it's been, not that it's been stressed, but it has been training with you. It's been prepared by you during your pregnancy. So it's not getting stressed out by this extended period of labour or these changes that are now happening as it's trying to kind of exit through the birth canal. It's going to be more likely to be of an average or normal birth weight, which is obviously good news for your baby. It's going to experience less fetal distress. Enhanced neurobehavioral maturation. So essentially what we see, that's brain development. So the brain development is better as a result of that exercise that you were doing. And a possible decrease in labour time, which is always good for your baby as well. And it means less likely of intervention like instrumental deliveries or possibly resulting in an emergency section. So loads of benefits of being active during exercise or during pregnancy. Mental health benefits we see again from Margie Davenport. 1 in 7 people, that's huge, isn't it, experience depression during pregnancy. And there's so much going on, you know, particularly if you have any kind of complications, like maybe you've got some pain, maybe you haven't been able to work, your body's changed massively. There's a lot of you know, sometimes there's financial challenges. There's a lot of change that happens during pregnancy. So I suppose it's not surprising that there is such a high incidence rate of depression during pregnancy. And then we've got the hormonal changes on top of that. But if you exercise during pregnancy, you're less likely to experience depression, anxiety, or insomnia, and also experience higher psychological well-being. So it's really beneficial, not just for your physical health, but for your mental health. And really importantly, I think it's important to understand that there's no link in the literature, no link between exercise and miscarriage, stillbirth, neonatal death, preterm births, premature rupture of membranes, low birth weight, birth defects, inducing labour, or birth complications. So all of there are massive what we call systematic reviews. So that's where researchers look at all of the studies that have been done over the past, kind of maybe couple of decades, and they examine all of the research. And in none of that research could they link women who trained and exercised during pregnancy with a higher incidence of any of those events. Some of them are going to happen anyway in people who are inactive and in people who are active, but there's no causal relationship between the exercise. So just because you're active or training or doing any type of activity, it doesn't mean that you're more likely to go into labour early or to have a complicated birth or to have a miscarriage. And I think that's really, really important as well, is to just take that kind of fear-mongering out of it as well, and help women to understand that if you're active, it's beneficial to your baby. It's not increasing your risk of any of adverse effects. But there is a risk of inactivity. So as I mentioned, most of these already, higher risk of complications. There's also lower uterine blood flow. So the blood flow, the less active you are, the less blood is actually flowing around your uterus and around your baby. And that's not beneficial for your baby at all. So increase, and sometimes we think, and there has been a school of thought in the opposite direction, where the more active you are, the less uterine blood flow there will be because your blood is going maybe to your working muscles, and that has not been proven to be the case. Actually, the more inactive you are, so if you're on bed rest, if you're just sedentary for large parts of the day, that is reducing the blood flow to your uterus, and that's like your baby needs blood and nutrients and oxygen and everything to grow. There's an increased likelihood of a vulvovaginal tear during your labour, or the chance that you have to have a C-section. There's some really interesting research at the moment around the intergenerational advantage. So this is the kind of, what you're passing down to your baby. So what we see, and I guess it's kind of getting quite complicated, but what the research is seeing is that if you're active and exercising during pregnancy, that it's inducing epigenetic changes in your baby, which means that they're more likely to have a healthier and a happier kind of, life and not experience complications later in life, as well as just in the immediate kind of birth process. And there's no known benefits of bed rest, despite, out of, I think, mainly fear. A lot of women are placed on bed rest during, pregnancy if there is any kind of slight, maybe complication. That there are some contraindications, and if you're experiencing any, kind of complication or anything that you're not sure about, then it is obviously really important to speak to your healthcare provider, your midwife, your GP. But there are far fewer contraindications than, what we were originally thought there were. So some of the massive ones, I think these are common sense anyway. Like if you're experiencing chest pain, like even if I wasn't pregnant and I was experiencing chest pain during exercise, I think I would stop, or I would go and get that checked. Shortness of breath that doesn't resolve when you rest. Severe headaches, dizziness, feeling faint, uterine contractions. Again, some of these speak for themselves. Vaginal bleeding or other fluids lost from the vagina. I mean, that they're all really self-explanatory, I think. So certainly if you're experiencing any of those, it is not wise to continue exercising, and you should seek advice from your healthcare professional. Any questions so far on any of that? Okay, super. There are a few things now which are kind of coming out in the research as well, that we would traditionally have been told to avoid during pregnancy. So things like lying on your back, or exercising on your back. So sometimes there's that, and it would have kind of been built into most of the guidelines that, particularly after the first trimester, that you shouldn't do any exercise on your back. So you shouldn't be lying flat on a yoga mat or on a bench or things like that. And actually that has been kind of disputed now in the most recent literature. So there's no reason to suggest that it's dangerous to your baby, but sometimes it might just be uncomfortable. Because it does, sometimes you might get some compression on the lungs that makes breathing that little bit harder. But you're not doing anything to kind of hurt or harm your developing baby. It just might feel a little bit uncomfortable in later pregnancy stages. But if it doesn't feel uncomfortable, there's no reason why you can't keep doing it. So if you like bench pressing and you like lying flat, and you want to keep doing that the whole way through your pregnancy, that's absolutely fine. In terms of heart rate and kind of high intensity exercise, again, the traditional guidelines would have said, don't exercise above 145 beats per minute. We now have some research that you can see the references there, really recent research done in the past few years, which has looked at doing high intensity interval training. So with a heart rate between 87 and 105% of maximum heart rate. And there's been no adverse outcomes to fetal heart rate or umbilical blood flow. So they took people who were pregnant, they trained them doing high intensity interval training, really high heart rates, really high intensity work for short intervals. They measured fetal heart rate and they measured umbilical blood flow, and there were no changes. There were no significant changes during those. So that data around the 145 beats per minute possibly is a little bit outdated and needs to be revised. Resistance training, again, you know, that's kind of the one that would be typically like, don't lift anything heavy. I mean, you are preparing to now have to lift a baby, a buggy, a car seat. The weight of those things is incredible. So to say don't do anything for the 9 months before that, and then we're going to hand you a 10-pound baby, you know, a 35-kilo buggy, a car seat, all this kind of stuff, like, is, you know, again, not really the best preparation. And again, the research is showing that at 80 to 90% of your 10 RM, that's quite significant lifting, there's no adverse effects of lifting on your baby or on your maternal health. And those who continued to lift heavy had fewer pregnancy and delivery complications. So this research was done in people who were already resistance training. So it's not like we're saying take, you know, a woman who's never done any weightlifting or resistance training. These were heavy lifters already, and they continued to lift heavy throughout their pregnancy, and there were no adverse outcomes to that. And they actually benefited them in terms of there were fewer complications to their delivery and during their pregnancy in the ones who continued to do the heavy lifting. Body heat, again, is another one that has been linked to exercise that we kind of think, well, actually, now that we look at the evidence, where did this link come from? So we know that it is not advisable for your body temperature to rise above 39 degrees during pregnancy. Ever really, but during pregnancy in particular, that can be quite dangerous for your baby. And I suppose the school of thought was that, well, if you do exercise that's of too high in intensity, or you exercise in the heat, then that's going to increase your body temperature above 39 degrees, and that's going to be bad for your baby. So the research in this is really interesting, actually, because you can see the reference there. The study that they did looked at pregnant women and non-pregnant women. And actually, the pregnant women had a lower body temperature to begin with. So it seems like the body is actually adjusting during pregnancy. And it's decreasing the body temperature to accommodate those increases that might happen during exercise. And also, we've got better sweat mechanisms. So we're getting the heat to the surface of the skin quicker, and it's evaporating quicker. So all of our kind of ability to control our body temperature, it seems to be upregulated during pregnancy. So the body is so clever. It's so good at adapting to our life stages. And that's just, I think, a fantastic, like, you know, mind-boggling way in which the body is allowing us to keep exercising in a safe manner. Sometimes we hear about kind of, oh, you know, you've all this joint laxity and you can't do anything, or you're going to dislocate a knee or a shoulder or a hip or something like that during pregnancy. And, you know, in theory, I suppose we do have, you know, an increase in hormones like relaxin, which do have an impact on joint laxity, but we can't see that link with an elevated injury risk during pregnancy in the literature. So there's no concrete evidence to support it, but I suppose in theory, there does, you know, it would make sense that there might be, but it's certainly not something that should hold you back. And then there's a really interesting kind of emerging research area around contact sports during pregnancy. And the interesting thing is that we've always been told absolutely no contact during pregnancy, especially, you know, not after the 12-week mark. But the guidelines that advice is based on actually comes from really, really old, decades old car crash data. So, you know, while we're not recommending that you kind of put yourself in a scrum during, you know, when you're maybe 20 weeks pregnant, it is interesting how something, you know, that can grow legs, you know. So something decades ago that looked at the impact of car crash in kind of contact on pregnancy outcomes was then applied to sport, which just seems a little bit, again, kind of fear-mongering. So watch that space if anyone is involved in contact sport, if any of your Mead ladies maybe are out the, you know, thinking of pregnancy or what they can do, because that is going to be some lovely research coming out in that in terms of kind of what's safe and what people are kind of able to do maybe. So just on to kind of some of the considerations then. So what kind of changes are happening during our bodies in pregnancy? The diastasis recta is one of the maybe kind of most widely known complications of pregnancy. So what we have is we've got this band of fascia that travels over our abdominal muscles called the linea alba. And when we're pregnant, that widens. So you can see in the first picture there, the one with the box around it. You can see the widening and the separation of that linea alba. And that's really normal and really necessary during pregnancy. Okay, that has to happen to accommodate this growing bump. And 100% of women who are pregnant by weeks 35 will have a diastasis recti. And sometimes it presents as this coning or doming that you can see in the second picture. And it's nothing to worry about, it's nothing to be concerned about, it's perfectly normal. It happens during pregnancy, it allows for the bump to expand, and there's no reason why you can't keep exercising throughout it. But sometimes people have maybe like a fear when they see that coning or doming in particular, that they're doing something dangerous or they're damaging their abdominal muscles and they need to stop doing abdominal exercise. And you're not damaging your abdominal muscles. This is naturally happening as part of the pregnancy process. And hopefully you can see those numbers, but what this is the findings of a research study that looked at a 12-week pelvic floor and abdominal exercise program versus a control group. So people who did no pelvic exercise or abdominal work, just did their kind of normal exercise. And there's no difference in the numbers. So these are measuring that interrecti distance. They're measuring the widening of the linea alba. And look, there's no difference, 37, 36, 57, 54. This is millimeters, 30 and 30 in the follow-up. So they measured it at baseline after the 12 weeks of exercise and another follow-up, which I think was after the delivery. So there's no difference for those that did their abdominal exercise, and they didn't worsen their interrecti distance, they didn't widen their linea alba, they didn't make the situation any worse. And in fact, what they were doing is preparing those abdominal muscles for the challenge of childbirth and preparing the pelvic floor for for recovery after childbirth. So, yeah.
In my normal yoga class, and I was trying to avoid her doing book pose and different things like that there.
Yeah.
It's okay.
It is absolutely okay. Yeah. And it's okay to work the rectus abdominis as well as the trans abs, even after pregnancy too. So a lot of the time what we're told is, you know, it has to be trans ab exercise and you can't do your traditional ab work. And no, yeah, it is absolutely okay. It's not making the situation any worse. And it is keeping whatever strength you've got left. You are going to lose some strength in the rectus abdominis, the outer layer of muscle, because that's the one that's being kind of stretched and widened. But you're offsetting some of that loss by continuing your ab work. So the concluding statement then was pregnant women with diastasis recti should not be told to avoid abdominal and pelvic floor muscle training throughout pregnancy because it's actually beneficial. Yeah.
So it'll be more kind of based around comfort.
Yeah, exactly.
You might have to adapt it rather than say avoiding, for example, kind of spinal flexion.
Yeah, if somebody is, and you know, again, you might have somebody at 20 weeks who's just not capable of any spinal flexion and or it's not comfortable for them. And you could have somebody else at 35 weeks who's still able and happy. And that, you know, again, that there's no risk of what they're doing. That you're not damaging, you're not separating anything any further, you're not widening something unnecessarily. You know, that's absolutely fine. Again, and just like I said, their comfort's key. So whatever they're happy with and whatever they're comfortable doing is important, yeah. And again, like that, if they're not experiencing any adverse effects of lying on their back, then there's no reason why they can't either. So yeah, a lot of kind of, you know, as I said, like really upsetting the status quo here and challenging kind of what we've been told for years and years. And it's a case of, well, why were we being told that? And when we look at the evidence, actually, no, it was never tested, it was never looked at, it was never explored. It was just thought, oh, well, you know, she's pregnant, don't have her lying on her back, don't have her lifting anything heavy, don't have her doing ab work because that will separate the linea alba further. So when we do actually look at the science, a lot of it can be thrown out the window, which is great. And, you know, again, like it just comes down to, I think, challenging our cultural norms, because we do have that kind of culture of doing everything, you know, making life so much easier for a pregnant woman and not having them do anything that's strenuous or, yeah, exactly. Or, you know, so I would always say, think of what they're training for. They're training for the most challenging physical task of their lives. So we really need to get them in good shape to do that. Sorry. Yeah, there's a good screening tool that you can use as well. So that's a new questionnaire, the Get Active questionnaire for pregnancy, that arose from the new guidelines. So that's something that people can use at home. They don't need to, you know, it doesn't have to be carried out by a doctor or physio or a coach or anything like that. They can use it themselves just to give them an idea of where to start, what's okay. Or, you know, maybe if you have somebody that comes into the gym and they're pregnant, that you could use that screening tool with them just to see, are there anything that we do want to be kind of aware of, you know, or careful of, or can we just crack on? So it's a good one to kind of use maybe in the future, ladies. Right, we move on to postnatal. Yeah, any questions before?
I suppose for somebody who, say, was inactive, is now pregnant, what would be kind of considerations for them getting into exercise? Or
Yeah. So again, the old guidelines would have said don't start in the first trimester. So you wait. So if you've been sedentary, you haven't been doing any training, and now you're like, oh God, I'm pregnant, I need to get in shape, you know, I need to kind of future-proof maybe, or prepare for delivery, or that. The old guidelines would have said you can't do anything, don't start being active before the 12 weeks, whereas now it is okay to start at any point, just gradually. And the same, same thing we would do, I think, for anybody who is sedentary. You're not going to throw them into a high rocks class, you're not going to get them, you know, kind of deadlifting 50 kgs or whatever. You're going to introduce them to things gradually and progress slowly and gradually. So it's exactly the same way. You know, but it's okay to start in that first trimester, it's okay to start at any point. Yeah. Okay, so the postnatal active period. So the first thing in this, I suppose, is that question always comes up about what is postnatal, what is postpartum? What does the kind of, and the two terms are the same really, you know, they both mean the same thing. So it's just after you've had a baby or after you've given birth. And the period, like, you know, when does postpartum end? And is it to do with, you know, kind of the physical side of things and when you're kind of fully physically recovered? Or some people would say, well, actually, you're always going to be postpartum. So once you've had a baby, you're always postnatal and your body has changed. So you're dealing with a new body now. So there's a, you know, I guess when it comes to kind of different maybe attributes, like, you know, the time frame in terms of healing, recovery, and return to baseline is different, okay? Typically, the changes that we see, or what we need to focus on in terms of postnatal recovery, you're going to have pelvic floor changes if you've had a vaginal delivery. Sometimes even if you've had a C-section, just because of the load that you've been carrying for 9 months has strained the pelvic floor muscles. So typically, you've got 50% less strength and less endurance in the pelvic floor. And I would direct anyone back to that first session. You have it recorded in terms of pelvic floor training. If anyone is kind of postnatal and experiencing any pelvic floor issues, that have a look at that, and you'll get loads of information there. We also see, obviously, because of that diastasis recti, you see abdominal fascia strength is reduced. So there's going to be kind of weakening of the abdominal area. You're going to have kind of musculoskeletal recovery or changes. So pregnancy itself, and then obviously the childbirth, whether it's by section or by vaginal delivery, that has massive kind of repercussions for the trunk, the abdomen, and the kind of hip and pelvis. So there's a lot of changes. They go under enormous stress during pregnancy. Everything is kind of widened and shifted and moved and condensed and pushed out of alignment and so on. So there's a lot of recovery then that needs to take place around the trunk area. So the lower back, the abdominal, and the kind of hip and pelvis. And those changes can take up to a year, we now know, to return to baseline. So, somebody might be moving on and back to normal in every other aspect of their life. But there might still be some kind of musculoskeletal issues around the back and hip area for typically up to a year, kind of after having a baby. I did mention postnatal depression. That is one of the most common complications, and exercise is like our kind of first tool to fight against postnatal depression. There's massive breast changes, for anybody, regardless of whether you're breastfeeding or not. And then it's also important to remember that the postnatal period is kind of like a temporary menopause, because it's a really low estrogen state. So until your menstrual cycle returns, you have no estrogen in the body. And for some people, that can be for months after having a baby. And then if you're breastfeeding, that could be until you stop breastfeeding, somebody's menstrual cycle might not return. So until you're cycling properly again, you've no estrogen coming in. So when we think of all of the effects of having no estrogen, that, estrogen is required to keep the pelvic floor muscles good and kind of strong. It's required for bone health. Really important for bone health. It's required for mood. So, all of these kind of things make sense really when we think about that. And there are a lot of healthcare professionals now who are advocating for vaginal estrogen to be diagnosed in the postpartum period. And it's currently only licensed to be diagnosed for somebody who's perimenopausal. But obviously it would have massive benefits for somebody who is postpartum, particularly for, some women will breastfeed for a year or more. And that's a long time to go without estrogen, considering, how important it is in the body. So with regards to pelvic floor recovery, the pelvic floor muscles during a vaginal birth are stretched 300% of their original length. So, and that's without any kind of birth injury or trauma, like, having an instrumental delivery, they're, needing forceps, having an episiotomy, or things like that. So, but I suppose the important thing, I'm not trying to scare you ladies. The important thing to remember is that you can do a lot to prepare the pelvic floor muscles for that. Okay? Yeah, absolutely. So you can train your pelvic floor muscles for that, so that they're really strong and really flexible and they can bounce back. I'm not saying they're going to bounce right back, but you can train them throughout your pregnancy. You can train them, start them from now. You have obviously the low estrogen state. That's not going to be good for your pelvic floor muscles as well. Natural recovery seems to be maximized by about 4 to 6 weeks postpartum. So that means all of the kind of natural healing that those pelvic floor muscles are going to do will be done by about 6 weeks postpartum. Okay, but 50% of people after having a vaginal delivery will experience urinary incontinence beyond 6 weeks So that means you need to train your pelvic floor muscles. You need to train them to get them back into place. And it's like your abs. You know, like if we're training our abdominal muscles or we're after giving birth, our abdominal muscles will recover somewhat. But then we start training and we start exercising, maybe because, you know, they're kind of aesthetically pleasing and we want them to look good again. The pelvic floor seems to get forgotten about because it is, you know, the hidden muscle, I guess. It's really, really important to functioning, and it also is linked with your abdominal muscles too. And remember, you know, it's the floor of the whole core cylinder. So yeah, definitely look at that, the pelvic floor and training piece that we did a few weeks back. So you do need to rehabilitate them. I would suggest everybody, I think it's fantastic, if possible, for every woman to have a assessment with a women's health or a pelvic health physio after pregnancy. And in some countries, that's built into their aftercare. We typically go for our 6-week checkup. It's all about the baby. And you might have, you know, a couple of questions. How are you doing? Are you feeling down? And what birth control do you want? So I think that kind of sums up our 6-week checkup. You know, so like really what you want is, well, is my pelvic floor intact? And what do I need to do? Because there can be nerve damage, there can be other things. And if you don't know them, if you've never had it assessed, then you don't know what needs to be fixed or what needs to be rehabilitated. But unfortunately, we don't have it built into our kind of maternity package, or at least our public package. But if it's at all feasible, and actually there's a physio that I kind of know or follow on physio on Instagram, and she said now, like going forward, every new mother that she's friends with is going to get a voucher for a women's health physio as their present. And I thought that's actually a great idea because it's something really useful and something that you maybe wouldn't do yourself. It was like, oh God, that's €150. I could be spending that on nappies or whatever it might be. So, you know, I thought that was kind of something that would be really, really appreciated, I'd say, by any new mother. With regards to postnatal depression, there's a link with urinary incontinence and postnatal depression, and it kind of makes sense when you think about it. I mean, if you can't sneeze without leaking, or you can't, you know, lift your baby without a little leakage, that's going to be quite depressing, isn't it? You know, you're going to be thinking, I'm not the person I was before I had this baby. So there is an increased risk of postnatal depression if you experience urinary continence of about 45%. So even that women's health assessment, fixing or training those pelvic floor muscles can impact your mental health. It's a link we probably would never really put together. Exercise is really, really important for kind of preventing and treating postnatal depression as well. And there's a good research that links the onset or when you start exercising. And if you initiate exercise within the first 12 weeks postpartum, you're much less likely to experience postnatal depression. And it doesn't have to be that you're back in the gym, you know, 6 weeks later. It can be getting out regularly, maybe for a walk. Think of blue spaces, green spaces. So getting out in the kind of bright lights, bright skies, you know, green spaces like kind of mountains, fields, lovely scenery around here to get your walks in and things like that. Or your blue spaces, your seas, you know, even if it's just a walk on the beach or things like that. They're really good for our mental health. So starting exercising regularly, and again, that's important because sometimes we're in this little bubble, you know, and we think like, oh, there's plenty of time. And there is, you know, it's not that it's pressure, but I suppose just remembering actually, you know, if I can introduce exercise that little bit earlier, then it's protecting me and protecting my mental health. And also that there is a kind of gradient here as well, and that the more exercise you do, the less likely or the bigger the reduction of symptoms. But again, you know, I'm not saying that in a kind of pressurized way that you need to be, you know, kind of back in the gym and doing 5, you know, sessions a week and things like that. It's not like that, but the research does show a link. Your diastasis recti, remember everybody, 100% of pregnant women are going to have one. It's perfectly normal. And it's normal up to about 8 weeks postpartum, after which it should have closed back in, but sometimes it doesn't. And if it's unresolved, and that means that the separation is still more than 3 centimetres after those 8 weeks, then it needs some attention. It needs some rehabilitation then at that stage. And again, that's something your women's health physio can help you with, and can give you exercises to try and kind of knit that back together. It's linked, it's good to get it assessed and to get it resolved and not leave it too long, because it is linked with low back pain, which can be just really debilitating for everything. It's linked with your ability to counteract intra-abdominal pressure. So if you want to start lifting again, that's going to maybe feel like you've no core stability, you've no core strength. You know, so it can kind of you reduce your likelihood maybe of doing those type of exercises. And it's linked with your body image and your confidence too. So, you know, sometimes people will stop exercising because they, you know, don't feel maybe that they're kind of getting any results or any benefits, and they're not getting that pre-pregnancy body back, and you know, they were all told we need to do. And again, and it's not because the training's not effective, it's maybe because the diastasis recti, the separation's still there, and it needs to be rectified. And again, you know, there are exercises, just kind of structured abdominal exercises that will fix it. You know, in very, very rare instances, surgery might be required, but really, really rare. The majority of it is just rehab exercises. Remember, the musculoskeletal recovery side of things can take up to a year. So research shows us that strength and endurance have not returned to baseline at 26 weeks. So again, remember that be kind to your body. You're not going to have, you know, just because your baby's 6 months old, you know, doesn't mean that you're not postpartum anymore. Okay, there are still a lot of changes that are happening, you know, to your body, and it's working hard to try and kind of return those to pre-pregnancy levels. Breast changes then. So obviously a lot of people will breastfeed during the postpartum period, and then that raises questions about, well, can I exercise if I'm breastfeeding? So there's no negative effect of exercise on breast milk. Okay, it doesn't, you know, even if you're doing high intensity exercise, some people would worry maybe that, you know, increase in lactate and things like that can damage the composition of the breast milk, and it doesn't. There's no research to suggest that. So breast milk is not negatively affected by exercise. The breasts are obviously going to change, and they're going to change in the postpartum period, but then they're also going to fluctuate in size on a daily basis as well. So typically you're going to require really good breast support, and a good idea, a good tip is to aim to exercise after you've fed. So shortly after you've fed, before the milk comes in again, when it might be more comfortable for you. And another really important thing to note is that postpartum recovery requires additional caloric intake. You have to fuel that recovery. And then if you're feeding a baby on top of that, you need to make sure that you're fueling properly for that as well. So the figure of an extra 330 calories per day is what's currently in the literature, but it's actually thought to be massively underestimated. So it probably requires even greater than that. But just make sure that you're fueling properly for breastfeeding. And because, you know, there's a lot of kind of links sometimes with kind of postpartum recovery and REDS, which we would have spoke about in the last session. So REDS is where you have a relative energy deficiency in sport, and it just means that you're not fueling properly for the sport that you're doing. So if you're not factoring in the extra calories that you need, then, you know, I'm particularly considering the pressure a lot of us put ourselves under in the postpartum period to try and lose weight and to try and get fitness back and to try and look like you did before and so on. That can sometimes kind of trigger deliberate under-eating in an attempt to speed that process up, which means then that you know, factor the breastfeeding and the caloric demands of that in on top, that it is likely that you might end up in a low energy availability scenario, and that can have lots of repercussions, which we spoke about the last time. There is a potential higher injury risk during breastfeeding as well, because it's a low estrogen state. So if you're breastfeeding, your estrogen is going to be suppressed. So particularly things like bone stress injuries, there can be a higher incidence of that. And And then just kind of important to note that maternal exercise during lactation may decrease childhood obesity risk. And that's mediated via exercise-induced improvements in the composition of your breast milk. So isn't that fabulous as well? You know, that just by being regularly active, that you can actually be protecting your child's future health, because your breast milk, the composition of that breast milk is changing, and it's kind of protective then for your child. So essentially, I guess kind of postpartum recovery should be treated like an injury, as in we should have a graded return to exercise. A lot of the time, as I said, we've got that kind of 6-week checkup and we're told, all right, off you go. And, you know, then everyone is kind of left to their own devices, and there's no guidance, there's no, you know, protocol to follow. And this is what I do in the first 6 weeks, and this is what I do in the next 6 weeks. It's just each to their own. And some people bounce back and they're absolutely fine and they're great and they're back in doing their usual gym sessions and that. And some people, it takes an awful lot longer. And you can be comparing yourself and thinking, well, you know, if they did it, why can't I? But remember, everybody's body is different and they all heal differently. And then there's loads of other things that go into kind of our healing as well, like your sleep, your nutrition, your stress. Is your baby sleeping? There's a lot of things that we can't even control, you know, like maybe your baby's been born with some health complications that can be very stressful. Are they a good sleeper? If you're up all night, then, you know, recovery is going to be really difficult, because that's our body's opportunity to rest and repair. The first and the most important thing is to prioritize recovery from any birth injuries. So make sure that everything is properly healed up before you start doing any exercise. And then if at all possible, get that pelvic floor assessment and see what's going on down there and what needs to be kind of worked before you do any more damage to it, I would say. And there you've got kind of similar guidelines, similar infographic, which will be, you know, available for you as well, just around your postpartum exercise. And it's very similar to what we've seen before, but, you know, it's just kind of advocating exercise is good in the postpartum period. It gives you time for yourself, maybe, you know, a little outlet time away from your baby, you know, and the constant conveyor belt of nappies and feeds and so on. Improves your fitness. It helps to kind of control your weight. Improves your mood, improves your muscle tone in your abdominals and your strength, and it can improve your own sleep if you do get the opportunity. And then it's kind of gradual as well. So, you know, like we would do in you know, with somebody who hasn't been exercising for a while, just, you know, or somebody who's returning from any other injury, it's a gradual and a more kind of graded return. There's some, sorry, I know you can't see that well, but it will be in your notes. But this is just kind of a return to running pathway, we'll say, that was developed. So I can't even see it here in my notes now. Hang on, let's see, can I zoom in? Yeah, it's not, so the font isn't great on it there, but essentially a postpartum runner is anyone who runs. So it's not just, you know, somebody who is a kind of a good runner, would say, or a competitive runner. It's anybody who engages in running and has had a baby. So if you're running and you've had a baby, you're a postpartum runner, okay? Prior to running, there should be maybe some key assessments done. So it would be look to assess the pelvic floor and see what symptoms are there and what induces those symptoms. So is it, you know, maybe that you're fine when you're walking and then when you start running, you get symptoms, or maybe you're fine running on the flat, but downhill running induces symptoms. You know, there can be different things, or it could be maybe not running related. Maybe it's a lift that brings on symptoms or things like that. So challenge the pelvic floor, see where the symptoms induce, take that step back and work just under that threshold of symptoms, and train the pelvic floor then so that you can kind of push out that threshold and the weight that you can lift or the speed that you can run at before symptoms are induced. I'll go through some kind of exercises that you can do, like, and if you can kind of tick all those boxes, then it's kind of right, you're good to go in terms of running. And let's see what else. Like, there, you know, there's an advocation for like a biopsychosocial approach, and that's like not not just looking at what you're doing in the gym or what you're doing on the track or in running or whatever, looking at the big picture. And that's where the things like, you know, are you fueling properly? Are you taking in that extra fuel because you're breastfeeding? Are you sleeping, you know, properly? What's the kind of stress situation like? You know, so looking at the whole big picture, I guess, because it all feeds into our performance and it all feeds into how well you're going to recover in that postpartum period. There's lots of kind of temporary supports that you can use as well. So particularly things like binding the bump in the postpartum period can kind of just support everything when you're exercising initially. It might be some kind of intravaginal supports like pessaries can be used, which are just inserted into vagina, support everything and allow you to train maybe without leakage, just while you're training the pelvic floor and getting it back to normal. And the pelvic floor, as I said, it maximizes, its natural recovery is maximized at about 6 weeks, but it could take maybe another 12 weeks of training to get it back to normal after that. In the meantime, it doesn't mean you shouldn't be doing anything. You should be sitting at home waiting for it to get better. Keep exercising, keep training, because that's all going to support the pelvic floor. And then, you can use some adjuncts, like even compression clothing, like compression shorts or leggings can be helpful as well. And then footwear. We spoke a lot about the importance of the mobility of the foot. There's a lot of foot changes happen during pregnancy. So you typically grow an extra foot size and your foot widens as well. So that needs to kind of go back to normal too. And that can play a role in terms of kind of the pelvic floor. So ankle mobility, foot mobility, all of those exercises are part of your postpartum training as well. And then like the importance of education, I think, can't kind of be underestimated. Knowledge is power. I always say that when, even if we know that what's going on is normal, I think that can be really empowering. Like, it's not that you're a disaster and you failed at postpartum recovery. This is normal. This is, everyone recovers at different rates as well. It is very individual. They're the kind of exercises that you can do just to assess whether or not you're maybe ready to, in particular, get back to running, because that can be, quite a high impact, taxing task. So can you walk for 30 minutes without any adverse symptoms like maybe pelvic floor leakage or back pain or whatever? Single leg balance for 10 seconds on each leg, and then progressing single leg squats, 10 reps on each leg. Can you jog on the spot for a minute? Forward bounds, 10 reps, hopping in place, single leg running man, calf raises, single leg bridge, and a single leg sit to stand. So if you can do all of those, then you should be absolutely fine to get back out on the road and to get running again. Whereas a lot of us kind of probably just jump straight back into running. And I'll never forget my first run after my first baby. I had to stop. I was like, where's the nearest ditch? It's just, nobody prepares you for that. Nobody tells you that this might happen. Not once did I was so young, naive, headed back out, not once think that that I mightn't be ready for this, that I might experience challenges maybe that I hadn't pre-pregnancy. You think you're going to have the lower cardiorespiratory fitness, maybe that it might take you longer to recover from, but you don't think of the likes of the pelvic floor challenges or the breast discomfort and things like that. So they're a really good way of knowing, okay, maybe if I can do all of these things, I might be ready to hit the roads again, or I might be ready to get back into the class that you're doing or whatever it might be. And then just to kind of summarize, I would say within the first 6 weeks, the priority is to allow enough time for recoil recovery and healing. Let everything heal up. If you can start doing some pelvic floor training straight away, that's fantastic, even if it's just diaphragmatic breathing. Avoid prolonged, repetitive and excessive downward pressure. So even standing for hours on end. That can kind of prevent the natural recovery, or can just delay the natural recovery process. So building in little breaks where you get to sit down or lie down and things like that can just speed up the healing. Diaphragmatic breathing, I mentioned, the pelvic floor muscle training, to build that in if you can, and then gradually increase activity once bleeding has stopped and all your wounds have healed. Within the kind of next 6 to 12 weeks, discuss your medical clearance. You should have your 6-week checkup. Ask about your pelvic floor, ask about kind of your diastasis recti, about readiness to return to exercise. They might not know anything. Chances are they probably won't. But they might know more than they did when I was having my babies, hopefully. Integrate then your power, your strength and endurance training. You know, and you can kind of look at some of those exercises on the previous slide. So you're just starting to introduce them now at this stage. And then introduce impact. So initially maybe at a horizontal way. So doing things maybe like planks or mountain climbers and that. So it's horizontal, it's less pressure, particularly on the pelvic floor, than the vertical impact, like the jumping and the hopping. And then once you're okay and, you know, you've kind of done a few weeks of them and they feel fine, then 12 weeks plus, you should, you know, typically be able to start considering your, you know, pre-pregnancy training patterns. But it will be very individual. It most likely won't be linear. So, you know, you might kind of get so far and then there might be a step back or there might be a new challenge or whatever it might be. But be prepared for that, I guess. And it's progressive loading like we would always do at that stage. Ensure proper fueling, bearing in mind the additional caloric needs. And remember, like being postpartum, some would say it's at minimum a year, and some would say you're always postpartum. So, you know, if things don't get back to kind of pre-pregnancy or, you know, exactly as they were, that's not to say that they can't be better, that you can't be stronger, fitter, healthier, more powerful, more, you know, it's like a perfectly natural life course that lots of women will go through and, you know, come out the other side of even better than they went in. That's it. Any questions on any of that?
Just based off a few clients who've come out the other side of it, C-sections and kind of recovery around that. Obviously there's a period of complete rest, and then after that, I suppose, around best recovery strategy around the scar tissue and things like that.
Yeah, exactly. So like typically again, you know, those first 6 weeks you're going to be very limited. I like, you know, and it's important to allow that time for the wound healing. After that, exercise is really beneficial because it'll promote blood flow, which will promote healing as well. You know, but again, comfort will be vital. Like, so when it comes to kind of doing abdominal exercises and so on, like everyone's kind of comfort level is going to be different there. But, you know, rather than doing maybe spinal flexion exercises, that you could do like leg raise exercises and things like that, that will start to kind of work the abdominal muscles that bit more. And, you know, some people find that things like scar massage is really helpful. That's a technique that people can do at home. And again, it just promotes healing and it promotes blood flow around that area. I would suggest, again, like the horizontal impact, you know, before the vertical impact. So the more load, obviously, that's been born, then the scar can become uncomfortable. And sometimes you see changes with the symptoms that are in line with the menstrual cycle too. So you might find that the scar becomes more painful at different times of the month. So that can be, you know, even just getting them to track that and track those symptoms can be good, because they can be more mindful then of maybe having to take a step back. But yeah, like, you know, other than that, once the scar is healed and the wound has healed properly, and sometimes you do get complications in the healing, and things might be delayed then. But other than that, like, you know, the plan, the progression can be similar. Yeah. And there should be less pelvic floor challenges with C-section as well. Not that it's the better way to go or anything, you know. Recovery, for me, that was my worst recovery. You know, yeah, it's major surgery. Yeah, that is, it's a really challenging period. It's very, you know, it's different for everyone though. Like, I have friends that's, you know, choosing C-sections because they sailed through it. So yeah, it's all so different, isn't it? Who knows what way it's going to go? But again, I think kind of that knowledge of knowing what's normal, what's not normal, and needs to be looked at and not to be ignored, because sometimes we see that as well. And, you know, you go through I think pregnancy, where it's all about, you can't do this, you can't do that, you have to take it easy. What about the baby? And then you have a baby, and the next day it's all about the baby, and there's nothing about you and your recovery and what's normal and what you should be doing and what you can't be doing, and the focus just shifts completely to the baby. And I think women have been very much left in the dark and left to their own devices, and even coaches and physios and so on are asking, well, where's the guidance and where's the protocols and the recommendations? And there's great stuff coming out. There is a postpartum questionnaire that can be used as well. So that same link for the Get Active During Pregnancies is a Get Active Postpartum questionnaire. So that might be a good one to use as well. So just to give you an idea of what you're dealing with and what, yeah. No problem. They can start, typically when people say they don't, to not exercise, to me, you're doing exercise all the time anyway. You're lifting heavy weights around, you're not resting. If you're on baby number 2 or 3 or 4 or 5 or whatever, then you're definitely not getting any rest. So it's about kind of being maybe more mindful about that exercise, but there's no time, there's no, right after 3 months, you have to wait until 3 months. But again, it's individual, so see how the healing, make sure that all of the healing has been done first. That's kind of key, that's paramount. In terms of the running, it would typically be advised maybe to wait until kind of the 12-week plus, but that's not to say that other people are not back earlier. It depends on what you've been doing during the pregnancy as well. We're seeing elite runners now that are training all the way through their pregnancies. There, some athletics events, marathons have breastfeeding stations at them now, like in New York there recently. I know, it's like a marathon's hard enough when I having to stop and breastfeed halfway through. So it's fantastic in one sense in that women are really pushing the boundaries now and saying, well, look, my body is capable of so much more than what we've kind of been traditionally told. But I think it's also important to note that, just because somebody is running a marathon and breastfeeding doesn't mean that that's the path that you have to take. We shouldn't be putting ourselves under pressure either. And if it's 6 months before you can get active again, then that's fine too. It is a very individual kind of case by case situation. Okay, thank you. Brilliant. Thanks, guys.
Few little bits and bobs out the back, your hands get stuck in.